welcome to Life in a Body You Love Chicks. I have like the most amazing guest for you guys. I've already spilled the beans about her to some of you, and I think you guys are probably more excited to hear from her than anybody else that we've guested. So I have with us Dr. Maddy. She is a pelvic floor physical therapist. Now, you all know I'm obsessed with physical therapy anyways. So the fact that there are people who like specifically will physical therapy your pelvic floor, stop. I feel like this is something every single woman on the planet needs to know about. I'm sure that it's important for dudes too, but I know for women, there's a whole lot of things that we're worried about down there. So, Dr. Maddy, I know you're a super busy woman. Thank you so much for taking time out of your schedule to be here with us today.
Thanks so much for having me, Nikki. That was such a nice intro. So excited to be here and talk more about the pelvic floor. I'm the owner of Inspire Pelvic Physical Therapy, located in Saginaw, across from Fashion Square Mall. And we serve patients in the clinic and virtually too.
That's awesome, because a lot of our listeners are local here in Michigan. If you're listening and you're like, where's Saginaw? We're in the Mitten State, people. But I know a lot of our listeners are long distances. And so it's really cool that you have virtual services too. So what the heck is pelvic floor PT?
Yeah, I've talked to a lot of people, asked a lot of people if they know what it is, and it seems like about 50% of people have heard of it. So that's still a pretty low percentage. It's physical therapy, or it could be occupational therapy too for the pelvic region. So any changes to your bowel, bladder, or your joints in the pelvic region, it's therapy that specializes in that body region. So I'm a general physical therapist, but with additional training on the pelvic floor. And that's the most patients we see is kind of issues in that area.
Cool. So like what types of things would somebody be having a problem with when they show up at your office? Why are they there?
Yes. So we see a lot of different things, but our main diagnosis is leakage. So it can be kind of what people consider minimal, but still not considered normal, is like a little bit of leaking with a laugh, cough, or sneeze. And then to the other end of the extreme, where just like standing in your house and you lose your whole bladder. So leakage is a big one. We see people with constipation, even that can be a pelvic floor dysfunction, pelvic organ prolapse, so heaviness in your pelvic floor. Postpartum and pregnancy is a big clientele that we serve too, and perimenopausal changes. Pain with sex, that's another big diagnosis we see in the clinic. A lot of people have been brushed aside for years because of that, and finally realize there's treatment for that. And then, yeah, just like core weakness, diastasis recti, people wanting to get their core stronger, low back, hip issues. Those are what we treat.
That's like a lot of things.
Yeah.
And all like really important things.
Yeah. We get some really cool cases. We get a lot of straightforward postpartum patients. We also see, I've had some patients that they've literally never had sex with their husband before because like they've tried, it was painful, and we're working with them, working on the muscles in the pelvic floor to the point where they can return to like intimacy with their, or like if they've never had intimacy with their partner, like return to that. So it's really, really fulfilling as a practitioner and patients.
That's amazing.
Yeah.
I think women just think when we have issues like that, that's just, it is what it is. That's how it is.
Mm-hmm.
So, meh.
Yeah. And I think for a lot of women, they might have had a bad experience with, it might have been a medical provider or even a friend, just well-meaning, but saying like, well, I leak too. That's like normal at this age, or like telling them it's normal, brushing them off, or saying like, you gotta just relax, it'll get better. Like do your Kegels, you're good. So yeah.
I can't wait to talk to you a little bit more in depth about Kegels because I have a suspicion, but we'll get there. But remind me if I get sidetracked. But yeah, like peeing your pants. Everybody's like, okay, well, you had babies, now you pee your pants. That's what it is. And I was like, wait, there's people who can help you not pee your pants?
Yeah.
Because, like, women would want to know that. Like, you don't actually have to pee your pants anytime somebody tells you a funny joke. Is that what you're telling us, Dr. Maddy?
Yes, that's what I'm telling you. So, and
Amazing.
it's a relatively, for a lot of women, it's a relatively treatable, mildly quick fix with the right tools.
A quick fix. So, okay, and of course, the human body, asterisk, you guys can't hold her to this. Y'all know the human body don't do what you always think it's going to do. But generally speaking, let's say I pee my pants whenever I sneeze or if I'm laughing really hard. Mm-hmm. And I come to you, like, what are we talking about on a turnaround time here to not be peeing my pants anymore?
So it really depends, of course. But typically it takes the body about 3 months to adapt to change. So that's kind of our average turnaround if we're seeing patients once a week for about 3 months. We have weird cases too. I had a patient where literally the only time she leaked was with jumping, and we did a couple sessions of strengthening and different things. And then like one session I was like, girl, your arches of your feet are collapsing every time you jump, which actually causes like a force transfer issue to the pelvic floor. And we got her like better shoes with arch support. Like in one session, her leakage was gone. Like, and we talked about like her jumping body mechanics. So some patients, it's like, I'm always shocked too. I'm like, oh my gosh, like what? It's still hard to believe sometimes. Can
I just say this is why I'm obsessed with physical therapy for the listeners. Like, I know my clients get sick of me because anytime something's wrong, I'm like, do you think you can get your doctor to write you a prescription for some PT? Like, I want PT for everything. Did you guys hear what she just said? Like, this woman just needed some different shoes to not pee her pants. Like, come on now. You go to people who understand the human body instead of just trying to Google things.
Yeah.
Okay, sorry, I'll get off my soapbox now.
It's not always that easy, but sometimes it's just like a different perspective and someone that's trained to look at your whole body and your body mechanics, and it can be sometimes a quick fix.
Yeah, and I'm sure there's other times where it like takes forever, but yeah, that's a good frame of reference. 3 months. Like I would totally do PT once a week for 3 months. Like,
yeah, yeah, to have the tools to live your life and not have that issue again. So yeah, that's kind of why I got into pelvic floor PT, because it's just amazing the results and like how, I mean, 3 months to me is quick. But
that's very fast too.
Yeah, it's just amazing how there's a lot of nerves, and yeah, there's a lot of different nerves that innervate the pelvic floor. So it's so adaptable to change. There's so much room for change, positive change too. So
that's amazing. I really thought that it would take a lot longer. Okay, I have to ask you about this. A friend of mine was going to get, what is this thing called? I think I wrote it down. Sala. I don't know. That's probably a specific brand, but the gist of it is it's some sort of machine that is supposed to replicate you doing a crap ton of Kegels. Mm-hmm. And that is supposed to make you not pee your pants anymore. And I was like, time out. Maybe it's amazing. I'm hoping that you tell me that it is, but I'm jaded about literally everything.
Yeah.
And I was like, I feel like this is the pelvic floor equivalent of when somebody tells me that they want to lose 50 pounds. And so their plan is they're going to strap one of those ab machines on to like replicate doing sit-ups. And I'm like, well, first of all, sit-ups aren't going to help you lose 50 pounds. And even if they would, that machine's not really actually like doing 50 sit-ups. So that's what I was immediately very jaded. But is there validity to these types of things?
Yeah, that's a really good question. So, I have a little bit of a biased opinion because we see people that have done MCELA and then they come to us because it didn't work, but there's probably people that have done it that like we just never see because it worked for them. Um, yeah, I've got a lady on my caseload right now that did MCELA. It seemed so it kind of like does a bunch of Kegels for you. So it's like it'd be like doing like a lot of exercise all at once, and it does build your muscle tone. She had a little bit of relief from her leakage, but not enough to be able to do all the activities she wanted to do. So it wasn't a complete waste of time for her. It kind of gave her a little baseline, a little bit of built her muscle tone in that area. And then the pelvic PT was kind of just like, boom, she was good. So I don't think she would have had to do the MCELA, but it didn't hurt her. It probably helped a little bit. Yeah, it just basically like works those muscles quite a bit. But yeah, I mean, the pelvic floor muscles are just a really small part to the puzzle of leakage. And I mean, having pelvic floor strength can sometimes help with leakage, but to me, it really comes down to like the entire body and how it's affecting the pelvic floor. If someone's like holding their breath and kind of bearing down with every time they jump, like they're gonna leak, even if they have like a super strong pelvic floor. So getting down to why the person's leaking is kind of the way to get it figured out for good and stuff.
So what you're saying is we can't just Kegel our way out of every pelvic floor situation?
No. And there's actually some pelvic PTs that like are completely anti-Kegel, like never ever prescribe that as an exercise. I'm kind of somewhere in between. We sometimes use Kegels as a tool, but no, it's usually, I don't know, the body works as a system. So
I can't hear the word Kegel and not start doing it. So TMI for my listeners, and they're used to this. I'm like, she said the word and now I'm Kegling, but like, because that's what we're all told to do, right? We're told like, you got to do your Kegels, especially after you have a baby. Everybody's like, you better do your Kegels or you're
yeah,
going to dance all the time. Sex is going to be horrible. Do your
yeah,
Kegels.
yeah.
But then I hear about women who have like too tight of a pelvic floor and like that is the thing. So then
Yeah.
I'm like, well, wouldn't Kegels be bad in that situation?
Yeah, another really good question, and we get this a lot. So I like to think of the pelvic floor like a trampoline. So it works optimally if you have the full range of motion. Like if a trampoline's like really, really taut, you're not going to get much like bounce, much power, even like coordination is not great. But if the trampoline is like actually not as taut, it's a little bit looser, you can get a lot more power and the muscles work optimally. So typically, I mean, it kind of depends. We see patients that have like really tense pelvic floors, and because it's really tense, it actually isn't working optimally. It's not, it sounds counterintuitive, but it's not actually as strong because it's like the muscles are only working through a limited range of motion. But typically, we want to restore the muscle length, and then we start to strengthen the muscles when they can work through that full range of motion. So yeah, it just depends. A lot of our patients, I mean, probably 80% of our patients are actually have too tense of muscles in their pelvic floor, and we need to get the muscles lengthened, and then we start to strengthen them again.
That's, did you just say 80%?
That's my guess. I don't have actual research and data, but that's
What you're seeing come in.
yeah, yeah.
That's a lot. Why? Is this because we're all literally just uptight and we're stressed out and we're clenching all the time? What's going on?
I think so. I mean, I think that's part of it. Like our society is just like, we have so much pressure and so much stress, which they've done studies on like stress and how the body responds, and like the upper traps, kind of your shoulder muscles and your pelvic floor are the two muscles that tense up in times of anxiety and stress. So that's part of it. And just a lot of times postpartum, moms try to like hold tension in their pelvic floor because they're trying to create like more stability in their body. Like their body has changed so much after having the baby. So all the muscles just clamp down, which isn't great. So yeah, getting that tension worked out first always helps with healing. So
That's crazy. I love that we're having this conversation because I think women just think, not to be like crude about it, but women just think, well, the tighter the better. Like that's what you're told. Like the tighter the better.
I know.
And one of my friends was literally told by her doctor, she was like, you have to go to PT because you're too tight. And I was like, wait a minute, you got bragging rights. Like that's like, what? You have to go to the doctor because you're too tight? But no, you're saying like 80% of women.
Yeah.
That's crazy.
Yeah. I mean, some cases, like even with leakage, if there's like very tense muscles, it causes the bladder to spasm and they're leaking because they're too tight. So in those cases, a lot of times like doing Kegels is actually like making the issue worse, or it's just not making it go away. So
I feel like this is like too much, but like this, my brain's always too much. Okay. So I feel like, oh my gosh, well, we all need to know what's actually going on with our pelvic floor, and everybody should go have an assessment.
yeah.
Because you might just be doing all your Kegels at the stoplight and just making everything worse. So
Yeah.
like, you got to know what the root of the problem is.
Yeah. I mean, we get women that come in and just want to be assessed and want to know where they're at. Are they too tense? Are they too loose, or whatever you call it? That's not a fun term, but anyway, like just
technically speaking, it's accurate.
Yeah. But a lot of times if there's some dysfunction, like even just a little bit of leaking, or you're peeing all the time, or you're constipated, those little changes often are signs that something's off with your pelvic floor, whether it's like too tight, too weak, or things have shifted around, like you've got like a little prolapse or something. So those are all the things.
I'm terrified of a uterine prolapse. I commented on one of your Instagram posts and I was like, I'm literally not kidding. It's at like the very top again, TMI, you guys, but when I was working as a clerk in the emergency room before I was a nurse. So, I mean, I'm a baby. I was like 19 and I'm like walked into a room and the doctor was like shoving somebody's uterus back in. And I was like, what the F just happened? And she was like, that's her uterus. What? Excuse me? So like my first ever hearing about a uterine prolapse was like the most extreme. It wasn't just like you have a little bit of pressure. It was like it was outside of somebody's body. And ever since then, I've been terrified. And I think it's why I just walk around doing Kegels nonstop, because I'm like, it's never going to happen to me.
Yeah. I think a lot of women are really nervous about prolapse. I think almost to an extreme. I don't know. So postpartum, they say like there's a pretty good percentage of women that have prolapse postpartum. And sometimes it resolves on its own. Sometimes you need a little PT to get it kind of back to where it needs to be. But yeah, I mean, I'm so passionate about prolapse. Like I post about it a lot, just because.
Good, because I'm terrified of it. So I can't wait to see all these posts.
Yeah. People respond really well to pelvic floor therapy for prolapse. So before you consider getting the surgery, do pelvic floor therapy. You probably won't need surgery. And if
that's amazing news to somebody who's terrified of a prolapse, because the surgery's trash. I can say it. Maybe you want to be PC about it, but like from what I've seen, I don't want a bladder sling. I don't want any mesh up in there. Like, bad news bears. So the fact that you can like PT actually helps for that. I'm like so excited.
Yeah. There's a time and a place for the surgery. I'm more conservative, of course, because I'm a PT, but usually like mild to moderate prolapse, if your prolapse is like hanging out several inches out of your body, you might need surgery, but actually might not. So,
yeah, see, and I figured once it got to that point, you didn't have a choice. Like,
yeah,
I just thought it was like, oh, well, I guess you have to have surgery.
yeah, yeah. So, yeah, we've seen the research says like grades, there's 4 grades of prolapse. 4 is like hanging way out of your body. Like 3 is kind of almost there. 1 and 2 is kind of mild to moderate. And the research that I've looked at least says 1 through 3 respond quite well to pelvic PT. About 70% of people do really well with it. And then, yeah, the grade 4 typically is surgical, but I've talked with PTs that have successfully treated it. So kind of case by case basis on that. But
Very cool. Okay, so women know if they're peeing their pants and women know if they're constipated. How do women know if they have a very mild prolapse?
well, basically the way to know would be to get evaluated by a pelvic floor therapist or your OB. Some primary care doctors know how to test for it. But some symptoms are feelings of heaviness in your pelvic floor or in your lower abdomen, usually worse as the day goes on, because it, like with gravity, it'll kind of get heavier as the day goes. If you're having trouble getting like all the urine out or all your stool out, those are common symptoms of prolapse. But if you have those issues, it doesn't really mean you have prolapse either. Like it might be something else causing that. But
Yeah, if it's not prolapse and people have a hard time voiding all the way, I know like for women as they get older, that's like a common reason that they get recurring UTIs because they don't void all the way. Is that also just like too tight pelvic floor?
it can be. That's a big reason. And some of it is hormone, like with hormones at like in the menopause years or perimenopause, like even when women are like in their 40s or kind of 35, you're kind of perimenopausal, hormones are starting to shift. And sometimes that causes your pelvic floor organs to shift a little bit. It's not bad. It just is different as you age. So sometimes like different positioning of your bladder can make it harder to get urine out as you get older. So we'll talk with patients about different like postures. It's kind of crazy because it's like we talk through pooping and peeing postures on how to get as much out as possible.
So I gotta know then, squatty potties.
Yeah, those are like the best thing in the world.
Do they help you pee better too? Or just
It
poop?
does. Yeah. It's good for peeing too.
See, ladies, get you a squatty potty to pee better too, not just to poop
yeah,
better.
yeah, it'll help relax your pelvic floor, get more urine out. There are caveat, like there's a small percentage of people that like the squatty potty just doesn't work for. They've tried it. So, but most people it really, really helps. And yeah, but there's a couple people like so you may hear that sometimes, but
Yes, again, everything individual. There's always outliers to everything, right? I'm just like drilling you. I'm sorry. This is so interesting to me. What are some of the changes that women do experience in that perimenopausal and menopausal phase? And then like what things can PT help with? What things are something that like maybe PT doesn't help with and it's like a hormone thing and like I don't know, like I feel like it's one of those things where women just settle into the fact that like, well, this is just what happens and it's probably not true.
hmm yeah, as people get older, I mean, their bodies generally get a little bit weaker. Your joints are starting to get a little bit more wear and tear. So, typically, as long as there's not too much tension, we want to get the strength going. So when we evaluate someone that's perimenopausal or menopausal having pelvic floor symptoms, we're always kind of aware that there could be and likely is a hormonal component to their symptoms. So we always take a whole body approach to treating someone. Just doing exercises and stretches and manual therapy alone isn't always all of what someone needs. So typically, most patients, if they're having pelvic floor symptoms, we do a pelvic floor exam their first day, where we're checking the muscles of the pelvic floor, gloved hand, just kind of pressing on the different muscles, seeing if they're too tight or too loose. There's 15 muscles down there. And then we also we can look at the tissue integrity, the tissue plumpness. If the tissue is like not looking plump, if it's looking like a little more like friable, I think that's the word. Just usually that means there's a hormonal component. And even with breastfeeding moms, same thing. They're lower estrogen. They're more prone to pelvic floor dysfunction because they're having less hormones, less plumpness to their pelvic floor. So if we see that in women, we like to help screen for it and advocate. I'm a big proponent of like vaginal estrogen cream. So a lot of times when I'm working with the OB-GYNs in the area, if I see someone that has symptoms and is looking like there's a hormonal component, sometimes combining a little estrogen therapy or hormone therapy with PT is just the ticket for them. There's some over-the-counter products too. Some women are like, they don't want to do estrogen. There's some like older studies on estrogen that were debunked, but still people are nervous about it. So there's some other products we recommend to patients if they're having some hormonal changes.
Cool. Yeah, because like, I don't know anything about this, but from what I've been told, if you go for too long without using like vaginal estrogen or something and your vagina like lining is atrophying, you don't get that back, right?
Yeah, it can be tough.
So it's like you don't want to kick the can down the road for too long. And
yeah, ideally with all this stuff, ideally getting it taken care of as soon as you can ends in better results. But I always say like it's also never too late. But yeah, some of the hormone changes, like some people get like narrowing of their vaginal opening. So it's an uphill battle once it's already narrowed. So if we can hit it sooner, it's usually better.
wow. I like that you have people in your area that you collaborate with on these things and that you have this good relationship with these docs. I think that's really important. I don't think we get that enough in medicine. It's usually like, okay, whatever, talk to your OB, right? And there's no communication. So that's really nice.
Yeah, it is really cool.
What, if anything, pops into mind? And if not, that's okay too. But what things do you think are just like common misconceptions that we have as women about this whole wide topic, or things that you just like wish you could like grab us and scream at us and shake us and be like, no, this isn't true?
Yeah.
Whatever kind of thing.
Yeah, there's a lot of misinformation about things. But I wrote down a few misconceptions that I wanted to share today. One of them is that postpartum women should never do crunches. I don't know, that's like on TikTok or something, but
they're saying that postpartum, even women who had a vaginal delivery, they're telling them not to do crunches?
Yeah, because there's a fear like you could get like, or if your abs aren't working right, you could get diastasis recti. So it is kind of based in truth. Like we want people to have the right form when they're exercising postpartum. If not, like it can lead to issues. But there's a lot of like fear mongering, I think, with like, okay, like some of my postpartum patients like will never do a crunch, like they refuse, even though I'm like working with them and like, yes, you can do this, like I'm your PT or whatever. No, I just like watched this one video on TikTok and like, I don't know, it's like, oh no, if we have the right form, you can do crunches so that's one of my things. Another one that we talked about, you just need to strengthen your pelvic floor. Not everyone just needs to strengthen. Sometimes it's a body mechanics issue. Sometimes it's actually your pelvic floor is too tense. Just doing Kegels is almost never the answer.
This is what I suspected about Kegels, just because I'm like, that just can't be the answer for everything. So like, same thing with the sit-ups. Like,
yeah.
The sit-ups are not how you're going to lose a bunch of weight. Like, they're a piece of some people's puzzle, but it's not like a panacea.
Yes. Yeah, definitely.
Guys, I can't stop doing it though. Dr. Maddy, I cannot stop doing these Kegels.
Are you Kegling right now?
Yeah, I can't stop. What's my problem? What if we're habitual Kegelers? What do we do about this?
I know. You're probably too tense.
Me?
Yeah,
I'm always too tense.
I mean, some people like we're actually just working on like the coordination of like how to relax those muscles, like how to stop gripping their abs all day, how to like not be Kegeling all day long. So
I've been doing this all wrong for 20 years.
Questioning your whole life.
Yeah. I have so much to unlearn. Okay, I did not mean to interrupt you. Keep going.
Oh, you're good. Let's see. If you're having pain with sex, just drink wine. Okay, that never works. But a lot of people are told that by certain, I don't know, people.
They're like their grandma. I feel my grandma would give that kind of advice.
It's kind of a stereotype, but kind of like older male doctors will tell patients that. Not every male doctor says that, but it's kind of like the stereotype, kind of the haha in the pelvic PT world. Like, okay, your doctor told you that. Like, is he an old man? Okay, yep, okay, yep. That's what they always.
Is your doctor geriatric?
What's that?
Yeah. Is your doctor geriatric himself? Yes. Okay, let's not take sex advice from this guy.
Or if it's a female doctor, it's like, okay, well, you probably have pain with sex yourself, because I don't know, I guess you're trying to give this advice, but that does not actually work. Let's see. Another misconception is you have to have issues during pregnancy to go to pelvic floor therapy. And we like to see patients during pregnancy just to do birth prep, like one-on-one, like here's some birthing positions, here's how you can breathe to minimize tearing, here's how you do like perineal massage. So
well, that's amazing. So like birth prep.
Yeah.
Oh,
yeah, it's kind of like a personal trainer for like getting you ready for the biggest athletic feat of your life.
All of my pregnant friends are getting texted as soon as we get done here.
Oh my God.
These are things I wish I knew. Like, my boys are 20. Nobody talks about any of this. It was like, lay on your back, and if you tear, we'll cut it. But
yeah,
it's fine. You'll just get sutured up. Like, that was it.
Oh, yep. Yeah. A lot of people don't know about that. We're getting more, I think there's more awareness with social media and such. So we get more pregnant moms. One of my little missions is just like every postpartum mom at least knows about or gets a referral to pelvic floor therapy. I think every postpartum mom should get evaluated to see where they're at, what's going on with their pelvic floor after that. Even if they had a C-section, even more so, actually. If they had a major surgery, we want to see them in PT.
Elaborate on why that is.
Yeah, there's so many changes that happen with a C-section. The scar, we need to work on the scar, or else it's going to just like adhere and kind of thicken. Unfortunately, we see moms, pelvic floor therapy wasn't as popular like years ago. So we actually see a lot of women like now that are coming in and they're like in their 50s, they've had a C-section like 20, 30 years ago. And now they have back pain, just their core muscles weren't firing correctly. Their scar was adhered. And the good news is, like, a lot of those patients do really well. Like, we just get working on a scar tissue, even this late, even years out, we can get it going, and then reteach them how to engage their core. They do really well. But sometimes having that, anytime you're cutting through the abdominals, the muscles just, it's like a protective mechanism. The muscles don't want to fire. So we have to like intentionally tell those muscles to start firing again. If not, I mean, some people just aren't really using their deep core, and then end up like with the back issues down the road. So some of that, almost like C-section, is in a way preventative for back dysfunction down the road. We see a high incidence of pain with sex after a C-section too. The deep core muscles work really closely and kind of interconnect with the pelvic floor muscles. So changes to those muscles can really lead to pain with sex. I've been looking into that more because I'm like, why are all my C-section moms? It's always the C-section moms that have pain with sex. And reading more, I think there's something to that. Yeah.
That's really interesting because a lot of women feel like, man, I really hope I can just have a C-section. Like, they don't want to have a vaginal birth because of what they think it's going to do to the vagina, and they're going to have all of this pain. And, you know, and it's always like, well, no, you never want a surgery if you don't have to have one. So like, some people obviously have to have a surgery, but I've heard many, many women who are like, but can I just get my doctor to schedule a C-section for me because I don't want to have a vaginal delivery. It sounds painful, blah, blah, blah. And it's like, I knew obviously recovering from a surgery is always going to be more cumbersome and painful, but I didn't even realize that it can actually cause pain during sex without a vaginal delivery.
Yeah. We get a lot of postpartum moms that were like, hey, like, let's check your scar. And like, if you're comfortable, we'll do a pelvic floor exam. And they're like, why would we do a pelvic floor exam? Like, I didn't even have a vaginal delivery. And I'm like, let's just double check if you're comfortable with it. And like, then they're like, oh yeah, I guess I do have like pain with sex now. And oh, like, well, I am leaking. Things kind of come up. But yeah, it really causes a lot of changes. And props to all the C-section moms. I used to think that, I'm like, man, I kind of want to just schedule C-section, like easy peasy, right? And then I went on YouTube the other day and I watched a C-section. Woo! It's gory. It's scary. It's really intense. So man, those moms really have a lot of healing, and I give them major props. And moms that were pushing for hours and then ended in a C-section, oh, that would be hard too. So either way, however you delivered,
There's no easy way to have a baby come out of your body.
No.
Either way it comes, it's going to be rough.
Yeah.
But then you have a cute little baby and you forget about it, and then you do it again.
Yes.
And then you definitely need to go see Dr. Maddy. Did you have any other misconceptions you wanted to share? Because I keep getting us sidetracked.
I think that's it.
Cool. We hit them all.
Yeah.
Awesome. Well, thank you so much. I know our listeners are going to absolutely love this. Where can they follow you on social media? If they're local, work with you. If they're interested in working with you and they're not local, like, how can people find you?
Yeah. If you go to our website, www.inspirepelvicpt.com, if you're interested in learning more, getting more information, there's info on the website. You can also fill out an inquiry form and we'll shoot you a call and just chat about what might be going on, see what you're looking for. If you're wanting one-on-one help or just resources, we can chat. We also have our Facebook and Instagram pages, a lot of free educational videos, a lot of funny stuff. And that's on Facebook, if you just type in Inspire Pelvic Physical Therapy into your search bar. Instagram, it's inspire_pelvic PT. And you can find us there, and hope you check that out.
You guys have to follow her. So I'll interrupt and just say this. First of all, I'll put all this in the show notes for you guys. But like when I'm on Instagram, I don't really follow anybody on Instagram. I hate reels. I hate videos. I make videos all the time. And here's my confession, you guys. I don't listen to videos. I'll listen to podcasts or I read a book. I don't like videos. I love your videos. I could watch your reels of you on the toilet and like doing all these weird things. I could watch them all day long. Like you're literally my favorite person on Instagram right now. So you guys have got to follow her. The videos are awesome. They're entertaining, but they're actually helpful. Like you did the one about like foods to avoid if you have bladder spasms all the time or bladder irritation.
Yeah.
I have bladder spasms constantly without a UTI. And so I was like, I need to eat those foods. Like you guys will learn a lot. So you definitely got to follow her.
Yeah. Yeah. Thanks so much. I never thought I would do a handstand on a toilet until until like a couple months ago, and I was doing it and just trying to get the word out, embarrassing myself for the sake of us all learning. So yeah.
She's taking one for the team, ladies. She's embarrassing herself for the pelvic floor health of women everywhere.
Yes. And I never tell my husband what I'm going to do. I just say, stand there, hold the phone and video me. And he's always like, what? You're doing handstand? No, stop. And I'm like doing it. So yeah.
You guys could have like your own channel of the process of him recording you probably. Like it could be like a couples thing.
I know. I need to make a reel of just like all of his like reactions. Like, like you can just hear him audibly gasp in some of them.
That's amazing. My husband doesn't get told anything I'm doing for my social media or my podcast or anything, mostly just because he's judgy. He's like, I do lives sometimes in like pajamas. Like, I don't really care. And he's like, you could like maybe be more professional, or like I'll be talking about something wild. And he's like, you are going to talk about that to like the public? And I'm like, yeah.
Uh-huh. He probably wouldn't approve of this conversation either.
Probably not, but pish posh. He would approve of the conversation. He would be like, but did you have to overshare? Thank you so much. I know the listeners are going to love this. You guys go follow her on social media. And if you are local or long distance and need a pelvic floor PT, Dr. Maddy can hook you up. So go to her website and we will catch you chicks next week.
Thanks for having me.
You're so welcome.